This conference will now be recorded.
Hi, this is Kimberly McNeil, and I'm one of the auditors with the North Carolina Medicaid EHR Incentive Program. Today, I'm going to discuss the Security Risk Assessment, also known as the SRA. This webinar will explain why an SRA is important and what we look for when reviewing SRAs during the post-payment audit process. What is a Security Risk Assessment? According to the healthit.gov website, it is an assessment used to ensure that your organization is compliant with the Health Insurance Portability and Accountability Act's administrative, physical, and technical safeguards. And why is an SRA important? Conducting an SRA helps to ensure that healthcare organizations and/or entities are doing their best to keep patient information secure. The HIPAA security rule requires health organizations to complete a security risk assessment. Also, as a participant in the Medicaid EHR Incentive Program, conducting an SRA has been and will continue to be required for meeting meaningful use. So when should an SRA be conducted? A security risk assessment should have been conducted when you first adopted an EHR. Please keep in mind that you must review the assessment each year and anytime there are changes to the practice. If you adopt a new EHR or the EHR is updated, a review must be conducted. As previously stated, to meet meaningful use, you're required to complete a security risk assessment and review each year. If you are selected for a post-payment audit, you are required to submit a copy of your SRA along with your plan to implement security updates as necessary and correct identified security deficiencies as part of its risk management process. Here are some tips for post-payment audits. Be sure the SRA is dated within the calendar year of the MU reporting period. Please note the date of the review can be outside of the MU reporting period, but must be within the calendar year of the MU reporting period. For example, if your program year 2018 attestation is selected for post-payment audit, the date of the review must be within the calendar year of 2018. Be sure to define the scope of the risk analysis, including what areas and/or systems will the assessment include, such as any devices that stores, access, or updates protected electronic health information should be included in your assessment. Identify potential threats and vulnerabilities to patient privacy. This includes internal and external threats as well as natural disasters. You want to make sure your system has proper data backups in case of severe weather or power outages. Also, you want to describe how to protect against potential threats. Those include physical, administrative, and technical safeguards. A few examples of physical safeguards are alarm systems, security cameras, screen protectors, and locks. Some administrative safeguards are policies and procedures and training provided to employees. Password controls is an example of a technical safeguard. Also, you want to review and update your risk analysis on a periodic basis. It is very important that reviews be completed annually. You also want to make sure you develop a corrective action plan. This plan should include detail any deficiency found during the assessment and how to resolve the issue. We have provided a list of several resources that are available to assist you with conducting a security risk assessment. This list includes links to the security risk assessment tool, guidance on the technical, administrative, and physical safeguards, the SRA tip sheet, as well as the HIPAA security rule. These links can also be found on the program's website, resources and webinar page, and the FAQ page under the audit section. If you have any questions, please send an email to ncmedicaid.hitinvestigator@dhhs.nc.gov.